Welcome to Worldwide Business. I'm Kathy Ireland. For many diabetic patients, detecting nerve damage often happens too late, when serious complications are well underway or even irreversible. Impeto Medical is a medical device company that offers early detection of such complications. CEO and founder Philippe Brunswick is here to talk about their innovative, non-invasive pseudoscan device. Welcome, Philippe.
Thank you. It's so great to be here,
Philippe, can you please explain the potential impact of diabetic nerve damage on both patients and the healthcare industry?
Yeah, this condition is very bad. Nearly 70% of all diabetic patients, 50% of them are often not aware of that. You can lead to a silent heart attack, to falls, to very bad pain. Mm-hmm. So it's a very, very bad condition and very costly condition today.
And can you please tell us what Impeto Medical is doing to address these challenges?
So we try to get the disease as early as possible because there is no treatment if you get the disease too late. The idea of the technology is really to find out the patients at the very early stage when the condition is still reversible.
Well, let's take a closer look at Impeto Medical's disruptive medical technology in this Worldwide Business Field Report.
Since we focus primarily on diabetes in this clinic, we see the full range of diabetic complications. When we think about diabetic complications, we think about macrovascular complications, and that's when we're trying to reduce the risk of heart attack and stroke. The other complications we think about are called microvascular complications, and that's what people generally think of when they think about diabetic complications. They think about the eyes, the nerves, and the kidneys. Complications of diabetes, in my opinion, are much more difficult to treat than the disease itself. Technology, diabetes medications are constantly coming to market. We have more tools than ever before when it comes to diabetes, but the complications are not getting much easier to manage. Potentially half of patients with diabetes have diabetic nerve damage, whether or not they're aware of it. In our clinic, we employ a pseudoscan to measure small fiber peripheral neuropathy. What that device does is it sends a low voltage through the sweat glands in the palms and the feet, and there are stainless steel plates on the other side measuring what they call electrochemical skin conductance, which just is a fancy measure of the conductance through the sweat glands. The reason why we use those nerves in the sweat glands is because we can detect abnormalities at the earliest stage by using those specific nerve fibers, and it actually makes it a quite easy and practical way to measure nerve conductance. I recommend that if other physicians treat diabetes, they should consider getting a pseudoscan as part of their practice. Currently, we have very straightforward ways to monitor and detect kidney damage, to detect eye damage, but we haven't been as good about detecting alterations in diabetic nerve health. The physical exam is certainly helpful in detecting neuropathy, but adding a pseudoscan may detect even more underlying nerve damage. And I think it's a very proactive way to head off diabetic complications and possibly even disability for the patient.
Philippe, can you please discuss why early detection and prevention of neuropathic complications is so important?
The complication is very bad. Mm-hmm. There is no treatment today for if you get it too late. It's very expensive because recent publication has shown that patients with conditions with a painful diabetic neuropathy costs 4 times more than a normal diabetic patient. So it's a very bad condition. So the only way to get this solved is really to prevent it and to find these conditions as early as possible, and especially to look at small fiber neuropathy.
And is neuropathy reversible?
Yes, at the stage of small fiber neuropathy is still reversible, as Professor Gordon Smith showed it and wrote it and published it in the 2009 already, exercise can do better, recover the small fiber. You can have, if you stop the insult, because often it's an insult that creates this neuropathy. For instance, vitamin B12 deficiency, if you give back vitamin B12, it reverses the process. If you have excess vitamin B6, for instance, you have a neuropathy. So you have to find out the real cause behind this neuropathy, and then if you stop this insult, then it recovers.
Peripheral neuropathy is a condition that causes damage to the longest nerves in the body, starting in the feet, working its way up to the legs, and eventually, if severe enough, into the hands. And this can cause a number of symptoms, including numbness, tingling, pain, loss of feeling, which can lead to imbalance and falls, and one of the most dreaded complications of diabetes, foot ulcers and foot amputation. There are a couple of reasons why we would like to have more easily performed, convenient, inexpensive tests of small nerve fibers. One is to facilitate diagnosis in patients who have small fiber neuropathy, but the other is to recognize patients at the earliest stages of neuropathy, or ideally to recognize patients before they get neuropathy. We're particularly interested in exploring these various techniques in a screening methodology to try to prevent neuropathy. And the analogy is in diabetic retinopathy, diabetic eye disease. In the United States and in most places in the world, all diabetic patients come in at least once every couple of years to have photographs taken of their eyes to look for early diabetic eye damage. When that's recognized, there are treatment strategies that can be used to prevent blindness. Our hope is to develop small nerve fiber tests that can recognize patients as they're developing small nerve fiber injury ahead of symptomatic neuropathy, so that we can institute prevention strategies to prevent the problem the same way our colleagues in ophthalmology are using eye exams every year to prevent blindness.
Can you please tell us about the test Impeto Medical has developed?
Yes, so we developed a very innovative test with the idea is really to stress the sweat glands at the maximum ability to deliver chloride. So we apply small voltage, DC voltage, on the large electrodes, as you see, and then on the very large surfaces with many small glands, we are able to stress all these glands and to get out from these glands all the chloride ions. So it's like a stress test. So you are able to do the test, to do it again 5 minutes afterwards, 10 minutes, or after effort, something like that, you get the same results. So it's a very robust, reproducible test, and at the same time very sensitive because it's sweat glands, as I explained. It's managed by these very small nerves.
And so the patient, would they place their feet on this? How does this work?
Yes, so they place the feet and hand. We push a button on the screen, and then after 3 minutes, you have an immediate results like this one. So you can immediately see your results. So you can share between the physicians and the patient what is on your feet, what is on your hand, right feet, right hand. You see immediately if it's symmetrical, for instance.
Right.
So that's a good information first. If you are diabetic, there's no reason why you should be more diabetic on the right, on the left, so it should be symmetrical. And the more chloride ion you have, the higher the current is, the better. So you have these results, for instance, on the feet, very high conductance, and this on the hand is so-so.
Philippe, how does pseudoscan compare to standard neuropathy progression measurements?
That's a very interesting question because we perform many clinical trials on that. One of the main ones was on bariatric surgery, where we tested patients before bariatric surgery and then 4 weeks, 8 weeks, 12 weeks, 24 weeks. And we did at the same time all other tests, large fiber tests and other autonomic tests and sensory tests and things like that. And what we showed is that pseudoscan was able to see the recovery of these nerves due to the bariatric surgery, where all the other tests were completely flat, so not sensitive enough to see any recovery. Why? Because large fibers takes a long time, to recover, very, very long time. And the beauty of these sweat glands is that these small fibers are regenerating 2 times quicker than any other nerves. So it's the best way to see the efficacy of any treatment that you provide.
Philippe, what kind of impact can pseudoscan potentially have on a patient's quality of life?
It can have a huge impact because then you can find the real cause of their neuropathy. Instead of treating the symptoms of pain, for instance, you try to treat the real cause of it and follow up the treatment of this cause. And this is very important because painful diabetic neuropathy is terrible. You cannot sleep anymore. It's a terrible situation, terrible condition.
And could you please discuss how this test contributes to both a value-based system and patient compliance?
Yeah, so value-based is very, very important, as you know now in the healthcare industry all over the world. And we are able, in fact, to prevent costly complications.
Right.
And it's 4 times more cost, for the diabetic patients with pain. So if we can prevent these conditions, obviously you can reduce the cost and have a better value-based reimbursement system. Everybody's happy with that.
Right.
Okay. The other application is that we can give very easily to organizations a very nice epidemiological view of their populations, of their diabetic populations, where there is diabetic neuropathy today. And so we can give some statistics and epidemiologic statistic on that. So that's very interesting. And the third point is compliance is key, for diabetic patients. Compliance is key. And as you see, it's very easy to read. So any patients can understand that something is going on. So this is a typical screen of the results. If you want to screen again the patient, you just have to do a new scan, and then everything is ready to do a scan. You can add some comments and things like that. You can check the electrodes, check all the things, and then you just push a button when the patient is there, and you have the device going on for 3 minutes. Okay, so it's very, very simple. You can have access to all the history of the patients. We have many tests on. It's very important to look at the follow-up of their history. We can have 10 different tests in the past, so you can really see the trend. You can see many, many other features. You can see hand, feet, right hand, left hand. You can really go in big detail. You have an access to the symmetry, which is something very important because I mentioned that for diabetic patients, symmetry should be 0, but some patients have asymmetric. So it's another cause, could be vascular, could be entrapment of large nerves and things like that. So it's very important to follow up the symmetry too at the same time.
What are some of the reasons for a patient not being compliant?
There's many, many reasons why. I mean, it's cost.
Right.
Cost of the treatment
Sure.
often is very, very expensive. People don't like to be, to be ill, and they don't feel anything. They say, well, everything is okay. I don't know why I should take all this pill.
So they're not
I feel
taking
good,
them.
and things like that. So it's for diabetic patients. It's very difficult, to be always compliant.
Sure. But this tells you clearly the impact that it's having on you.
My pseudoscan experience was very informative. The printout report actually gave me a visual chart and breakdown of what's going on inside my hands and feet from a diabetes standpoint. It was very quick and painless. I basically placed my feet on the scanners and my hands on the scanner. Within 3 minutes, an individualized report was generated for me, and I was able, along with Dr. Erica, to see the results immediately. So it was quick, it was easy, no pain involved, and it was really a great educational experience. Because the results were immediate and my chart printed out, Dr. Erica was able to explain to me what the scan was measuring and relate it to my individualized diabetes management. So I was able to understand and to see what has been going on inside my hands and inside my feet. And then she was able to also give me very specific feedback from a medical management standpoint to help me do an even better job controlling my diabetes. It has really empowered and inspired me to continue to manage my diabetes effectively. And I believe that the pseudoscan is one more technology that we can add to our tools to help us positively impact diabetes.
As we close, Philippe, could you please share your vision for the future of pseudoscan?
Well, the future of pseudoscan, I think, first of all, we would like that every diabetic patient use pseudoscan to be better treated and to be better prevented from neuropathy. And the second big issue, as we spoke about, is prediabetes. I mean, we can find prediabetic patients quite better than anybody else, I think. And this is what we do in China, for instance, and we are really we would like really to push this application in the future.
Well, Philippe, it sounds like Impeto Medical pseudoscan is a revolutionary device that should excite both doctors and diabetic patients. Thank you for joining us.
Thank you, Cassie.
Thank you. For Worldwide Business, I'm Kathy Ireland. Thank you for watching.